Cynthia Lytle, Director of Strategic Partnerships and Community Engagement for Urban Mission Ministries in Steubenville. Today, I also represent the Neighborhood Community Development Center of the Urban Mission, who is so proud to partner with the Ohio Department of Health, the Jefferson County Health District, and the Steubenville City School Health District to bring you this special presentation, What Families Need to Know About COVID-19 and Vaccines. I am the proud mother of two hardy stallions,
Jackson,
Nina,
and one soon-to-be Puglisi West star.
Wayne.
As a parent, I totally understand the struggles that we faced over the past 2 years, from homeschool, remote learning, to all the uncertainties that swirl through our minds when our schools open their doors again. Together, we've come a really long way, but there's still a long way to go. If you're anything like me, you probably still have lots of questions about COVID-19 and how to really keep your kids safe during this time. Should my children still wear masks? Are the vaccines really safe for them? What about sports and extracurricular activities? Today, we hope that this special presentation answers those questions and more for you and your children. So I encourage you, parents, grab your kiddos, grab your parents, and watch this presentation together because it's just for you.
remember to stay safe.
Stay healthy.
Bye.
My name is Andrew Henry, and I'm the Health Commissioner for the Jefferson County General Health District. I wanted to share some information about mask wearing, more specifically as to when it's appropriate in the future of mask wearing. Mask wearing was a key mitigation strategy at the beginning of the pandemic and still continues to be one today when spread is high in certain areas. Mask wearing not only protects you, but it protects those around you. As the pandemic continues to evolve, mask wearing has become more of a local recommendation rather than a nationwide recommendation. And by that, I mean the CDC has changed their guidelines to reflect the spread in local communities rather than nationwide.
Currently in the United States, anyone 5 years of age and older can be vaccinated against the coronavirus, and it is recommended. There's a lot of misinformation that coronavirus is something that's already come and gone and that nobody can get hurt from it, but children still do get sick. Children still get admitted to the hospital. Children still die from coronavirus. So it is important. I advocate vaccines for many illnesses, from chickenpox, whooping cough, tetanus. Those illnesses are still present in the United States and children still die from them. Coronavirus, they die a lot more. And so it's not just the children though, it's their parents, it's their grandparents. It's not only protecting the child, but it protects their family. So of course the question is it dangerous? There's no evidence, no scientific evidence that the coronavirus vaccine will hurt your child or hurt you. The evidence is in fact quite the opposite. If you look at the number of young people who have been admitted to the hospital in the last 2 years since the pandemic started, there's been quite a number of them who've ended up from coronavirus in the intensive care unit, and if they're in the intensive care unit, to be put on a ventilator. Among children who've been vaccinated, this does not happen. And in terms of number of deaths of vaccinated children in hospitals, it's 0. They do not suffer serious complications from coronavirus, the illness. But then you might say, what are the side effects that happen from the vaccine? Any potential side effect that you could receive from the coronavirus vaccine is multiplied many times by the actual illness. So, as I said, you don't die from the vaccine, but you die from coronavirus. Well, you might say that's just a few kids. There's been over 1,000 children in the United States who have died from coronavirus. That's way too many. That's more than any other illness we vaccinate against. Again, more than chickenpox, whooping cough, tetanus, hepatitis, polio, all combined. So the point here is that even though we're tired about it, no one wants to talk about coronavirus. And honestly, I think in many ways we're coming through the pandemic, but the reason we're coming through the pandemic is we're vaccinating. So my advice, let's treat the coronavirus vaccine like we do those other childhood preventable illnesses. Let's not lose another child. Let's not lose another parent, another grandparent, an aunt and uncle, anyone close to you. We've done really well. We can make it through this. We're almost done, honestly, but now it's just moving into the period of time when it's important to vaccinate your children because it's the best thing for them and it's the best thing for their families. The reason it's important to get the vaccines is because it's sort of like training your body to become on the defense against an invader. And so the way the vaccine works is it actually teaches the immune cells in your body to produce antibodies that will neutralize and kill the coronavirus should you become infected. So what does that mean? That means that your chance of becoming sick is very low. And even if you do become sick, your chance of becoming a spreader of the illness is extremely low as well. So a lot of it has to do with the amount of vaccine that you receive. So what do I mean about that? Many people think, I've already had the coronavirus illness. People say, I've already had coronavirus, why do I need a vaccine? Because frankly, you don't know how much coronavirus you really got. The reason the vaccine is important is it's a standardized dose, and it's standardized for different ages. So we give the safe amount of vaccine that will provide an immune response that will protect your child or yourself, but it won't make you sick. And even if you've had a small exposure to coronavirus in the past, this will help you from getting a serious infection from coronavirus today.
Getting vaccinated is one of the best ways you can protect yourself from COVID-19, but there are other important actions you can take to keep yourself healthy. Getting at least 30 minutes of exercise a day will keep your lungs and heart working at their best. And getting at least a few servings of fruits and vegetables a day will provide you with the vitamins and minerals you need to let your immune system keep fighting for you. Here at the Jefferson County Health Department, we offer COVID-19 vaccinations in our Steubenville office on Tuesdays from 8 to 4, Wednesdays from 10 to 5, and we also provide them in our Toronto office on Mondays from 9 to 3. We carry Moderna, Pfizer, and the pediatric Pfizer. An appointment is preferred, but we do take walk-ins on those days. You can schedule an appointment with us by calling 740-283-8530. We are taking appointments for first and second doses, as well as third and fourth dose boosters. Getting vaccinated is one of the best ways you can protect yourself from getting COVID-19. The most important guideline to remember is to only test if symptomatic. It's also not necessary to test from being exposed. Test kits are more readily available. We at the health department have at-home test kits, or you can get a PCR through the local drive-through pharmacies. As we know, the guidelines are always changing, so it's important to keep up with the CDC and ODH for new recommendations.
Steubenville High School ensured our safety by following the CDC and Jefferson County Health Department COVID-19 guidelines. We didn't lose instructional time.
Yes, I am COVID-19 vaccinated. This was for the safety of my loved ones.
Yes, I am vaccinated to protect my teammates and my family.